Hi, my name is Nikki. Today I'm going to talk to you about your weight bearing on your hip replacement. So, when you have your hip replacement, whether you are still in the hospital or you are home, so you're going to make sure you put less weight bearing on the affected area, whether is on your left hip or your right hip. You put less weight bearing on it. Like let's assume you usually have 100% on the both hips. So for you to have less weight bearing on the affected area, you're gonna have to like put 50% on the affected area to avoid pain, uh, to avoid pain or the formation of the replacement of the hip. So and again, you're gonna have to um, make sure that when you are on the when you are your posterior side of it, no hip flexion above 90 degrees, no internal rotation, no abduction, so no crossing leg. So you're gonna have to make sure your hip is stay one place, so that uh, to avoid dislocation of the hip that you just fixed. The anterior side of it, no hip extension, no external rotation, no abduction, no leg crossing. Okay, just make sure your hip is stayed straight when you're laying down or when you're sitting down, to avoid the um, abduction or external rotation. So make sure your feet is in a good straight form. Okay, to avoid pains too, whether you're in the hospital, whether you're at home. you know Make sure you avoid it, to for your hip to heal properly, for you to have the for you to achieve the goal for the hip surgery. Okay, stay in normal posture, no leg twist, no movement. you know Make sure you place the pillow in between the legs, to make sure your leg stays straight, to avoid the internal rotation or external rotation, the anterior side of it or posterior side of it. Okay, that's how you take care of your hip percussion, to avoid dislocation of whatever the hip you just fixed. Okay, make sure you take to in pain side, you're gonna have to make sure you take your pain medication, because there's gonna be a pain, obviously. So the hip surgery is a little bit painful. So take your medication, follow doctor's order, your physical therapies, your OTs. you know that's how you will do it. Okay, listen to doctor's advice, no movement, no hip rotation, stay one place in the bed, straight, leave your leg straight. No abduction, no leg, don't cross your leg. No adduction, no abduction. Okay, in to avoid painful hip replacement is a painful stuff, and you don't want to do it and do it again. So you want to do it and maintain your posture, so it can heal right. Okay, it can heal right. So the anterior part of it and the posterior part of it has to be followed all the time, in order for you to achieve your goal. Thank you.